Hello people, welcome to Medicine Guy. This topic is on osteoporosis. Now before going to osteoporosis, let's have a quick synopsis regarding the concepts. Basically there are four important concepts: the osteoblast, osteoclast, PTH and estrogen. Osteoblast helps in secretion of collagen and mineralization of bones. Now these activities leads to bone formation. Okay, so to remember, consider the alphabet B in the osteoblast for build. So alphabet B is for build. Now coming to osteoclast, it dissolves bone by secreting H plus and collagenases. So in return it leads to bone resorption. Now to remember the function of osteoclast, just consider the alphabet C in osteoclast. So the alphabet C stands for consumption. Now the next important thing is PTH, which is known as parathyroid hormone. Now parathyroid hormone in a low dose has got a bone building effect on osteoblast. So therefore it is also used as a treatment measure. The last one is estrogen. Estrogen inhibits apoptosis in osteoblast and increases apoptosis in osteoclast, and hence it has got a bone building activity. Now getting back to osteoporosis. What happens in osteoporosis? Two things happen: the increased osteoclastic activity and there is normal osteoblastic activity. Mind you, there is increased osteoclastic activity, that is more bone resorption, and normal osteoblastic activity, that is normal bone formation. So bone resorption is more than bone formation. Now increased osteoclastic activity leads to increased bone resorption, which leads to decrease in bone units. As there is normal osteoblastic activity, there is normal mineralization also. Due to reduced bone units, there is reduction in bone mass density. This means that there is quantitative reduction in bone units, but quality-wise, the bone units are perfectly normal. As there is normal osteoblastic activity, there is normal serum calcium, phosphate and alkaline phosphate levels. Well, alkaline phosphate levels are a marker of osteoblastic activity. So as the osteoblastic activity is normal, there is a normal level of alkaline phosphate levels. Now getting down to etiology. Now there's a mnemonic for the etiology, but I'll say it later on. Now the etiologies are as the following. Number 1, hypogonadal and hematological disorders. Number 2 is inherited disorders like osteogenesis imperfecta. The third one is the most common, that is the nutritional disorder. The fourth one is drugs. Now there are many drugs which causes osteoporosis. Now steel, STEAL, is the mnemonic for the drugs causing osteoporosis. S for steroids, T for thyroxine, E for anti-epileptic, E for epileptic, so anti-epileptics, A for alcohol, L for lithium, and H for heparin. The fifth one is endocrinal, that is hypoparathyroidism, thyrotoxicosis, and Cushing's syndrome. The sixth one is rheumatological disorders like rheumatoid arthritis and ankylosing spondylitis. Now the mnemonic is hinder and steal. The drugs that steal and hinder cause osteoporosis. Everyone must have heard regarding DEXA scan. What is this DEXA scan? DEXA scan is dual emission X-ray absorptiometry, which is supposed to be the investigation of choice in case of osteoporosis. Now based on this DEXA scan, scoring is done. Now scoring can be of two types, the T-score and the Z-score or Z-score. The T-score is used in WHO classification where the DEXA scan of the patient is matched with the 30-year-old individual. In Z score, the DEXA scan of the patient is matched with an individual of the same age, sex, and race. Now coming to the scoring, the T scoring, a score of 0 to -1 is considered normal, whereas a score of -1 to -2.5 is considered osteopenic, and a score less than -2.5 is considered as osteoporosis. Now getting back to Z score, the Z score indicates secondary osteoporosis. That means the cause is something else. A patient with score less than -2 should be investigated for any underlying disease that results in osteoporosis. Another important thing is that the vertebrae are the most commonly affected areas in osteoporosis. So due to this, in radiology, we find that the vertebral height decreases due to collapse of the bone. The codfish appearance is typically seen in osteoporosis and can be seen in other diseases also. Now getting back to treatment. For treating osteoporosis, 3 categories of drugs are present. Number 1, the drugs that inhibit bone resorption. Number 2, that drugs that stimulate bone formation. And number 3, that has dual mechanism, the drugs that inhibit resorption as well as stimulate bone formation. Now coming to the drugs that inhibit resorption. The first one and the most important one is the bisphosphonate. They are a major class of drugs used for osteoporosis. Now they bind to hydroxyapatite and inhibit resorption. Example of bisphosphonates are risedronate and alendronate. Now risedronate is typically used to prevent steroid-induced osteoporosis. Zolendronate is a bisphosphonate which can be used once yearly. Now a typical side effect with bisphosphonate is that they increase the chance of proximal femur fracture. So X-ray hip should be done for evaluating a patient who is complaining of hip pain if he is on bisphosphonate. The next category under drugs inhibiting resorption is rank L inhibitor. Rank L is receptor activator of nuclear factor K ligand, which is responsible for osteoclast mediated bone resorption. So if we inhibit rank L, the osteoclast mediated resorption is reduced. The examples are number 1, denosumab. Denosumab is a monoclonal antibody against rank L. The second one is estrogen. The third one is selective estrogen receptor modulator, especially raloxifene. Tamoxifen is not used, raloxifene is used, and they tend to inhibit the rank L pathway. Now coming to the drugs that stimulate bone formation, the first one is PTH analog or the parathyroid analog. As we had discussed earlier, low dose of parathyroid increases the osteoblastic activity. Now for example, teriparatide is a PTH analog. Now to remember this easily, you can consider para for parathyroid and tide for increase. Low doses of PTH analogs are used. The rest are the supplements like calcium, which is given at 1500 milligram per day, vitamin D, that is 400 to 800 international units per day, and fluoride, which is given in a low dose. The last category of drug is the drug having dual action, that is, they tend to increase the osteoblastic activity and decrease the osteoclastic activity. Such an example is strontium ranelate.